Welcome back here. Look how murky it is outside. Wow, on this Tuesday morning, welcome in. 7:23 right now. So we've been talking about this all month. February is Heart Health Awareness Month. And you may have heard people talking about, going through a breakup, or they're sad, they have a broken heart, but this is actually a real condition.
And it often affects women more often than men. And here to explain what we all need to know is Dr. Drew Baldwin from Virginia Mason Medical Center. Thank you so much for joining us.
You're welcome. Thank you for having me.
We find this so interesting. Broken heart syndrome, what is that exactly?
Well, this is a heart condition that goes by several names. It's called broken heart syndrome. It's also been called stress-induced cardiomyopathy or heart disease. And it's also been called Takotsubo cardiomyopathy. That's a Japanese name that has also been used to describe it. And what it is when a very, very stressful event occurs to someone, the surge in hormones like adrenaline can overwhelm the heart muscle and can cause the heart muscle to temporarily fail. The heart doesn't squeeze properly and can cause a heart attack or congestive heart failure.
So this can be misdiagnosed as a heart attack, or like you said, are you actually having a heart attack? What's the difference there?
Well, it's not a typical heart attack. When people think of heart attacks, they usually think of plaque buildup in the heart arteries and then a blockage in a heart artery. This is a different kind of heart attack. It's not related to blockages in the heart arteries. It's more related to damage to the heart muscle.
And why are women more susceptible?
Nobody really knows. It's thought that in part it may be related to higher levels of estrogen, because it's thought that maybe estrogen mediates the surge in adrenaline and hormones.
So when we talk about symptoms, people watching at home, maybe they've never heard of this broken heart syndrome before. What kind of symptoms do we need to be on the lookout for?
Typically it's severe crushing chest pain, and sometimes also shortness of breath. And occasionally there can be other symptoms too, like palpitations or fast heart rates, but the usual symptom is chest pain.
Will it always follow some sort of episode of stress, maybe the loss of a loved one or something like that, or can it just come on normally? Or
so usually most of the time it happens after a very stressful emotional event or a very stressful physical event, like major surgery or a serious injury. But it can also happen just out of the blue, and we don't really understand why that happens.
I find it interesting. You and I were talking about this before we started the interview here, about how stress can have a very physical impact on our health. Speak a little bit more to that, because I know a lot of people who lead very high stress lives say, oh, it's fine, it's not really impacting me, but this seems to be evidence of how we're absorbing the stress.
So a few different ways. I mean, everyday stress is not good because it can lead to inflammation in the body, and that can lead to plaque buildup in the heart arteries. But that's a chronic process that happens over years. With broken heart syndrome, or Takotsubo cardiomyopathy, it's also called, the stress is a very sudden, extremely stressful event, and sometimes it can't avoid those.
Just for heart health reasons, I'm sure you see patients sometimes who are in maybe high stress jobs or have really high levels of stress. What would you say as a doctor to people are some good ways to reduce their stress, if possible?
Sure. Well, there are a lot of ways. I mean, exercise is a great way to relieve stress. And then there are stress reduction techniques like deep breathing and meditation, and people have other ways too. And there's a lot of great information on this on heart websites, like the American Heart Association website has great information about how to reduce stress in your life.
But definitely call a doctor if you're having these symptoms. I would imagine better safe than sorry.
Yes, if you're having severe chest pain or think you're having a heart attack, it's best to call 911 and get to the hospital right away. And if you have questions about things that don't seem like an emergency, then call your primary care doctor or a cardiologist.
Dr. Baldwin, thank you so much. Really fascinating.
Thank you. It's a pleasure being here.
Yeah, great to have you here.